Cancer hair loss and what to do about it is the topic of today's Hangout. Hi, and welcome to this first in a series of Google Hangouts on air addressing topics that are important to you and to many people throughout South Jersey. First, let me introduce the founders of Aesthetic Effects Hair Salon and Barbering, Ruth Ann McGowan and Paula Krasuski. Aesthetic Effects, also known as AFX Salon for short, recently moved to a new location in the Green Tree Executive Campus on Route 73 South in Marlton, expanding the salon to double its former size. Okay, let's get right into today's topic. Ruth Ann, Paula, can you start by discussing the side effects of chemotherapy and other cancer treatments? And maybe you could also tell us how much experience you've had in helping cancer patients.
Sure, Ken. I've been handling chemo clients for probably 25 years or better. Some of the effects, a lot of people don't realize that it's not just chemo that makes hair fall out, but it's also radiation. The closer to the scalp radiation has to happen, the more chance of hair loss. Anything from bald areas and a general thinning. We're able to handle all of that. The problem is, what we try to do is find out where the, how can I put it, where you are going to be in your chemo treatments when this begins to happen. There are some chemos are very aggressive. So say you're on a very aggressive treatment and you're going to probably start having your hair fall out around the third treatment or so. We like to find that out in advance so that we can match your hair exactly while you have your hair and match your style exactly so that you're going to feel like nothing has happened. There's no changes in your overall appearance. You don't look or feel sick in any way.
We usually grab a picture, anything recent to match their color, to match their style, as close as possible. And density before the hair loss.
Density, wave, pattern, style, color, length, everything, so that we can match you exactly.
How much experience have you had with cancer patients? I'm sure the public would like to know how authoritative you are.
How much experience I've had? Oh, I can't even imagine how many clients we've had come in, different kinds of cancers. We hear so much about breast cancer for women, but we've had cancer throughout every different part of the body, liver, kidney, prostate, brain cancer, unfortunately, all different types of cancer. Like I said, you hear so much about in this world, especially because we do a lot of women, we have a grand men's replacement as well. But for women, you say, oh, well, she must have breast cancer. You can't imagine how many clients come in here with everything but breast cancer. So I'm not making light of breast cancer, believe me, but I'm just saying we have experience in every kind of cancer, I think, that could affect the human body. I really do.
Could you discuss the state of mind of the cancer patients who come to you looking for help with their hair loss? How do you offer them hope and encouragement?
Well, obviously, when a client comes in, they're usually just getting over the shock of finding out that they have cancer. It's a word no one wants to hear, and I think everyone feels like it can't happen to me. So when you hear that word come from your doctor, you're usually devastated as it is. Probably the next step is, how long will my treatments, what will my recovery be, will I recover? Those kinds of questions. Once we get past that, we start thinking about how am I going to look? How am I going to walk out? I don't want the general public to know, I've lost all my hair and I'm going through chemo treatments. So that's the next question.
We just try to transition them into the stages as best as we can to make them as comfortable as possible in this horrible time that they're going through.
Yeah, it's a very difficult time, but when they realize that they can do something about their appearance, and not, and again, the old adage, if you look good, you feel good, it certainly plays a huge role in this process. So what we try to do is make you look exactly the way you were pre-chemo, so that you feel your absolute best. At least you won't feel like you look sick, and you're going to look exactly the way you always did.
I had a friend that told me that he had so many questions when he started chemo.
Yeah.
Simple things like whether or not he needed to shave after his first chemo treatment. Do you get a lot of questions like this?
Yes, we do. That's one of the first questions we get. Do I have to shave my head? What I recommend is you come in and get your hair cut short. Your doctor will tell you right up front when they tell you the different chemicals that will be used. They know at what stage you could possibly be losing your hair. My own mother-in-law, for instance, never lost her hair, but it did become a lot thinner. So there are chemos that are used that don't always cause all of the hair to fall out.
Mm-hmm. Yeah, my sisters did not either.
Right. Well. Paula's own sister had chemotherapy, and she didn't lose her hair. So there are chemos that do not affect the hair, and usually your doctor can tell you that ahead of time, or sometimes they'll say we don't guarantee it. So you can come in for a free consultation, and we'll discuss the chemos that you're going through. Usually I'll know which ones will cause hair loss and at what stage it will cause it.
I'm sure women wonder if they're going to need a wig. How do you answer questions like that?
We don't use the word wig. And the simple reason is we use a chemoprosthesis or a medical prosthesis or a cranial prosthesis. And the reason they're called prostheses is because they're so different than the common wig that you find out in the stores. There's the wigs that stretch over your head have wefts that are scratchy. Sometimes your skin becomes very sensitive while you're going through chemo during the hair loss process. Some people feel sensitive, not everyone, but different chemos cause different reactions in different people. So the wefted wig, per se, is very scratchy and uncomfortable. They also stop up above the occipital bone. So the problem there is if you're walking behind someone who's wearing a wig, you see that their skin is completely clean, the wig is high in the back, they're wearing a wig. But with a chemoprosthesis or a medical prosthesis, our bases are made of full skin around the entire perimeter with a mesh center, completely expandable and contractible. So what happens is we're able to make this prosthesis fit you while you are losing your hair, and it expands as your hair is growing back. And it's so much more comfortable. It does not slip. It doesn't need to be hair pinned in, and so on. And back to your question about shaving, again, we just recommend that you come in and see us, and we'll determine what kind of medications you're going to be on before we determine whether or not you should shave. Cutting the hair down to a short, close haircut, if you're going to be losing your hair, is probably the easiest step first without shaving.
Does insurance cover those prostheses?
In some cases, the insurance will cover up to 50%. They used to cover 80%. Now they cover about 50%.
Are there any special shampoos that are recommended for cancer patients?
We simply recommend a simple, very gentle shampoo. You don't want any kind of irritants. You don't want high alcohol based. You don't want anything that has a lot of wax coatings in it and things like that. So yeah, we just simply recommend a very gentle shampoo. Of course, we carry them here. And, there are many over-the-counter gentle shampoos as well.
What do you think is the most important thing you can do for these cancer patients? How do you feel you're making a real difference in their recovery?
I think just helping them feel their best while they're going through this, talking them through it, listening, understanding what they're going through. We certainly see, not only do we see a lot of it, but we've all had our own personal experiences with cancer as well, and with chemotherapy. Sometimes even benign tumors need to be chemically treated with chemo or radiation. So we've all had our own, like I said, our own personal experiences, and we certainly understand the trauma that one goes through when they're losing their hair. So making that person feel their absolute best and just having a very nice, friendly atmosphere when they come in, we just love to help the people.
Okay, that should wrap up this hangout for today. Remember, Ruth Ann and Paula host these informative hangouts twice a month. Check their website at afxsalon.com for the schedule and topics to be covered. And if you'd like to arrange an appointment at Aesthetic Effects, you can call 856-988-1700. They'll be happy to help any way they can.
Yes,
so have a great day, and we'll see you next time on Hair Salon Secrets with Ruth Ann and Paula.
Thank you, Ken.
Thank you.
We'll see you.